So we have an order for NG tube insertion. I'm hurt. Insert NG tube to low intermittent suction. Irrigate every 4 hours with 30 mL of NS. So that's what I'm going to demo now, is the insertion of a nasogastric tube. Verified my order. I'm going to gather my supplies. For this checkoff, you only need your NG tube insertion kit. Everything should be in here for you, okay? While I'm washing my hands, I'm going to fill my irrigation tray with needed water. And wash my hands. Knock, knock, knock. Hello, I'm Brandy. Did your doctor talk to you about a nasogastric tube? He did? Okay. What did he tell you about that? Okay, so yeah, it's just a tube that we're going to insert through your nose, and it's going to go down to your stomach. It's going to relieve, allow the stomach to rest, the GI system to rest. We're going to be pulling out any bile or liquid that is left in your stomach, okay? And you will not be able to eat or drink anything while we have this in until we instruct you further. Is that all right? Yes, yes, you signed consent. Can you tell me your name, date of birth? All right, any allergies? No. I'm gonna lift you up. While you have the tube, you wanna keep your head elevated. To put it in, I'm gonna raise you all the way into high Fowlers, is what we call it. So you're set up. How are you doing? You feeling sick to your stomach? Yeah. Well, this should help with that. Sorry. I'm doing a Y with my tape. And I'm also tearing off a little part to mark my tube once I measure it. Okay, so I'm going to put this towel here just in case. I'm going to give you some water. So as I insert the tube, I'm going to instruct you to swallow. Swallow some water, take some sips with each, every time I prompt you to do that, and it's going to help the tube go down, okay? If you have any issues, it's not going to be comfortable, but if you're in any distress and you want me to stop, then hold up a finger, okay? So first I'm going to measure. So measuring from nose, around the ear, to our xiphoid. In the mannequins, it's going to be much shorter. You're not going to get it this far. So I can mark my tube, or for me, I like to put a piece of tape there and then mark it later once it's actually in the nose. For future nurses when they come in, so they know that that's where it should exit the nose of that mark. Lubricant, don't actually use this. Tear is on the end of my NG tube. Let's see. I think that's everything. Are you ready, Miss Hurt? Mr. Hurt? Okay. Any nasal surgeries? No. Any facial surgery? No. Okay. Tilt your head forward a little bit. I'm gagging, so we're going to swallow, 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 swallow. All right. I'm to my mark. Take my Y tape and secure it. So I wrap one piece of the tape under and around, and the other piece the opposite direction. That should hold my tube. They do have anchoring devices now that are better than the tape. Before I completely secure it, I want to test and make sure it's in the right place. You always send these down to X-ray before you use them though, so these are not true tests. So I'm going to do a 20 ml flush of air. So clamp my NG tube just in case this person coughs or nothing comes back up. Anytime you open it, it needs to be clamped. I took the cap off my syringe, my Toomey syringe. Listen, got my whoosh. Very good. It sounds like it's in the right place, but I'm going to pull back some gastric contents. And got my gastric contents. If I had a pH strip, I could test. But since I don't, I'm just going to put those contents back in. Yeah. And then I'll flush with 30, per your checkoff, flush with 30 mils of water. So, take out your plunger, got my little medicine cup, pour it to 30 mils, that's basically all the way to the top. Plunger on, and pour in my flush. These stomachs are very small on the mannequin, so I'm not actually going to do it, I'm just verbalizing that I did it. It's gone down. Clamp. I'm going by gravity, so you want to make sure your syringe and your NG tube is above the level of the stomach. If I were sitting down low, it wouldn't go in, obviously. All right, Miss Hurt, it is in. How are you doing? You okay? I'm going to hook it up to suction. I've got to go get all my supplies for that, and then you're going to feel much better. So pin it to the gown. Miss Hurt, if you have any irritation in the back of your throat or in your nose, let me know. Try not to pull on this. If you get up to the bathroom, make sure it goes with you and it's not tucked under your pillow. And if you change your gown, or if the tech helps you change the gown, make sure they unpin it and pin it to the new gown so it doesn't pull. I believe that is everything for NG tube insertion. So removal, same exact process, just backwards, and you don't have to do all the testing because you're just taking it out. And Miss Hurt, your stomach feels so much better now. It's had all that rest. And then pull this tape off. And definitely wear gloves with insertion and removal of your NG tube, because there's always a possibility that this patient could get sick on you. All right, so I'm going to pull it out. 1, 2, 3. And wrap it up in our towel. There you go, and I'll lay you back down, okay?